There we go. Of the Ramaytush Ohlone, who were the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. The second item on the agenda is the approval of the April 7th, 2025 Finance and Planning Committee minutes.
So the minutes are before you. I did submit a amendment.
Yes. So on page 2 of the minutes, the second paragraph, last sentence, Commissioner Chow has asked that the sentence be taken out. The sentence is, they chose to continue to review and comment on the DPH contract work, but the authority now lies officially in the Director of Health. Just for you to know, the city attorney will be present at the full commission meeting and we'll probably get into this, but that's your request for these minutes.
Yes. I also asked that on page 4, where it says Vice President, under the Commissioner comments of item 5, that we add back in Commissioner Guillermo's name.
Oh, yes. There should be, it shouldn't be not, it should be,
Yeah, it's sort of an absent typo
yes.
or one of omission, right? So the minutes are before you with at least the amendments that we submitted, if there is a motion for that.
I'll move approval.
All in favor, please say aye.
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 Let's make sure there's no public comment in the room on the
yes,
minutes.
sorry.
Was there any public comment on the minutes in the room? All right, then the vote will hold. Thank you. Just want to make sure we're doing our
Thank
due
you.
diligence. We can move on to item 3, which is the contracts report. And Director Tsai, did you want to say something now? Okay.
Afternoon. I'm going to just kick this off and then turn it to Jenny and Michelle on the team. So we have had some, I think I mentioned in a few of the previous finance committee discussions that one of my priorities with the team is to make sure that for contracts, we're bringing increasing transparency, accountability, and a focus on outcomes and performance, all in support of the many excellent, often excellent providers and CBOs that we contract with. And I think our team has been doing quite a review and a deep dive on how to strengthen the entire contracting and oversight process with our nonprofits, CBOs, other providers. And that involves a range of different things, one of which is starting to pilot in this discussion a different way of presenting the contracts that we're bringing before the Health Commission. And the reason why that's important is because one of the themes of how our team is working through things is bringing together the program, oftentimes, sometimes clinical, sometimes other programmatic parts of the department, together with the contract folks and our finance folks. Those are 3 separate pieces that we have great subject matter experts on, and we have the opportunity to pull those together so that when we're looking at a contract, we have somebody thinking about all of those things in conjunction at once, and also to be constantly stepping back and saying, where does this contract fit in the broader scope of what we're trying to do, or what that particular contractee is doing with us as a provider? How do we think about the efficiency and effectiveness of the rate structures? What should be on a fee-for-service rate basis? What should be a cost-based reimbursement? Where is there more opportunity to make sure Medi-Cal reimbursement should be leveraged first, where they have a fee schedule, all of those different pieces. And finally, one additional, I think, challenge we're trying to solve for is we currently give a heck of a lot of paper and detail to the commission for each contract to review. Some of those things are very helpful. Some of those things are just a lot to absorb that don't always immediately lead to a conclusion about how best to utilize all that information. So we have quite a number of contracts to bring before the commission today. For 3 of them, we've tried a new template that starts off with very clear kind of being able to describe the contract and some of those more strategic elements and being able to identify the funding sources, the financing, the broader context. We've also provided all of the historic information, the many, many pages behind those, so we can contrast that. And I've told the commission members we would welcome feedback on what works, what's more effective or not. But I wanted to underscore this change in how we're approaching things is both for the purposes of helping the commission be able to better weigh in on contracts, but it also reflects a different way in which our teams internally are trying to work to bring things together, always with that bigger picture. And it will take some cycles before it fully settles, but that's something that Jenny, Michelle, the program leads, and all of their staff have been working very, very hard on. So with that context, I think I'm going to pass it to Jenny and Michelle.
Oh, I got it. Sorry.
Hi, good afternoon, Commissioners. Michelle Ruggles from the DPH Business Office. The first contract on this list and the monthly contracts report is the Marina Security Services. And this is one of the 3 that will be piloted. So I'm going to turn it straight over to Jenny Louie, our department CEO, who will be presenting this contract using the new template.
Commissioners, good afternoon. Jenny Louie, Chief Operating Officer of the department, here to present on the Marina Security contract. Before you is a proposed amendment that will increase the total value of the contract to $4.3 million, a difference of about $2.5 million over the life of the contract.
2 or 3 that had new templates.
Yes.
Yeah.
Yes, although the information is relatively the same in both of them.
We've got so many pages. Oh, okay.
I think those were included in the only project open hands. Marina.
Yeah, I don't think we got, well, in any case, okay. We now have them.
Okay, great. Thank you, Mr. Morowitz. Yes. Yes.
Yeah.
Yeah, and I will note, I want to thank the program staff as well as Ms. Ruggles and members of the business office actually for piloting DUES, actually sort of doing a lot of parallel work and thinking about our processes, but we look forward to your feedback in terms of this new template. So here on the Marina Services security contract, we're looking at a difference of increase of 2.5 million in the overall not to exceed amount. What's a little bit unusual about this, Dr. Chow, as you recognize, is that there's some ebbs and flows in terms of the expected spending of the contract authority over the current year and the next 2 fiscal years. And the reason for this is that the time this contract was initially approved by the commission, we were only expecting 4 locations within the primary care setting. And this was part of the work that we did to convert security services where appropriate to non-law enforcement safety ambassadors. However, over the course of the last year, we've been working with the sheriff's department. They've had some challenges due to some census and staffing issues of their own to fully staff the locations that should be staffed with sheriff deputies. As a result, to ensure that there was some sufficient security coverage, we have added 6 additional locations with 2 posts each at the clinics for 1380 Howard, Mission Mental Health, Soma, Chinatown, North Beach, and Maria X with 2 posts. They were not originally included as part of our original contract, but what we are asking for is to increase and expand for those services. In addition, as you know, we recently opened up 822 Geary, and we've decided to have a post there as well. And so what you see before us is a contract that for the next year sort of maintains the current service levels that have been ramping up over the current year. So we're currently about 1.2 million projected. We're going to try to annualize that to $1.9 million. At the same time, we are going to RFP out for additional set of security services where where some of the ambassadors have deeper level experience, including increased de-escalation experience for some of our clinics instead. And so at some point in the near future, you may see us coming back with an additional contract. So as a result, what we did was we are actually continuing services or making an assumption about continued services over the next year, but expecting to step back down to the original amount of the 4 original posts that we had. So it's a little bit of an ebb and flow, but we're making sure that we have sufficient contract authority for the identified locations in front of you. I think that was a lot, but I'm happy to answer any questions you may have on that.
Is there questions? Yes.
Yeah,
Thank
so
you.
I appreciate the explanation, and again, the summary that we just got is really helpful. But just a couple questions programmatically. So, or just to clarify, so the sheriff deputies were not able to staff the sites, and so you had to pull from this contract.
Correct.
And it's a cost
Correct.
reimbursement.
Yes, and I will just, there's variation in the sheriff's ability to staff. So they're not consistently staffed. So they're not entirely vacant, but just depending on the demands of the sheriff's department, there may be posts that go vacant for a day or two
So
as
this
they
is,
adjust.
this is a fill-in.
So
for when
exactly.
those are
So just
vacant.
ensure that we have some baseline level of services. We're adding 2 posts to the locations where there should be sheriff deputies, just to ensure that there's sufficient staffing to make sure there's patient and staff safety.
And the expansion to the outside of the 4 initial sites, right? So these other clinic sites or other, not clinics, but other sites.
The 4 original primary clinic care sites was part of the work that we did to really review all of our posts probably about 2 or 3 years ago. Mr. Wagner, Mr. Price did that review, I think brought that forward as a budget initiative for the commission. Those 4 will remain, and those 4 we will not change the safety ambassador contracted presence. So, but what we're looking for is just that additional contract authority to get us through this year and the next, and then return back to the previously assumed levels, with the assumption that we are going to be bringing forward another contract in the next few months that will take over those services in sometime next fiscal year.
And it states that there would be additional training or more experience. Can you share with us?
Sure.
what that
It's
would
really
be?
around de-escalation of services. So, I mean, the safety ambassadors were originally to be more greeters, as well as the security presence. But I think we're looking at the behavioral health clinics, which were identified as needing a higher level of service, hence, which is why they were maintained as sheriff posts instead of converted in previous years. We are looking for a higher level of service for when the sheriff deputies are unable to attend.
Sorry, and then lastly, thanks, but that it's not going to be monitored by BOCC, but by the program administrator?
Yeah, well, in general, like a contract such as this would not be monitored by the Business Office of Contracts Compliance, but they are in close communication with Director Price.
And for the future one, will it also not be monitored by BOCC?
It's still in development, but I would expect not.
Okay.
So it's still in the RFP process this time.
Thank you.
Okay.
Commissioner, question?
Yeah, can you hear me? Is this on?
Here.
Or not? Okay. So what constitutes success on this contract then? Is it safety? Is it people getting where they're supposed to be going? What is it?
Sure. I mean, one is just first off, consistent staffing and presence. And then should there be an issue that arises, that it's addressed appropriately and de-escalated appropriately. So.
Commissioner, further questions? No.
I don't think so. I just wanted to get clear in my mind that this is a security service, right?
Correct.
As opposed to a
Yes.
healing service. Got it. Okay.
Yes.
Thank you. So let me just follow up on this question of being able to evaluate. We've had the contract for about a year. There must be some feedback somewhere that someone's getting that this works or doesn't work. I mean, we have plenty of feedback on the sheriff, so it doesn't require BOCC to have determined it. Do we have feedback from the clinics that these people have been good or they've been, disrespectful or anything like that? I think that's what we're.
Oh, sure. Yeah, I can follow up, but I mean, there was interest from staff in terms of elevating the level of presence there from one post to two. So in general, it's yes, I think they are pleased, but I think I'll have to get back to you on the actual data regarding.
It's just looking at your new text also, which is very helpful in trying to understand that, matter of fact, it comes out quite clearly that it's not being monitored. And we probably wouldn't have spotted that as well in your older format. And the older format does, give a number of clinics, which you've already outlined, I think, in yours. So the two complement each other, and you could probably leave out any other. Well, in this case, we don't have all the performance things, but you recall that one reason we asked for performance evaluations was the desire to understand the outcomes of what the objectives were within the project. And so I think that if in fact your summary is able to actually summarize that, and I think as we go on with your other two samples, we'll be able to see how well that is. I do not believe the committee needs, the 15 pages of the actual performance, if in fact the performance is some sort of level that you've summarized for us. Does that
sorry,
make some sense?
The performance is at some level that we've summarized. I mean,
Yeah, I think the performance is when we're looking, and we just take this opportunity to give a little feedback here as we're going along. At least in my mind, we'd like to know, okay, did it do what it should? This may not be the perfect example, but in this case, did the security guards do what they were supposed to do? And did they do it to the satisfaction? Was there feedback from, in this case, the clients, which are the clinics, for example? So that's kind of what we're looking for. And if this were a regular performance contract with services, if we can get that information and we can look at maybe your other one or two samples, then perhaps you get a better idea of what we're actually trying to look for, and that rather than us going through the 10 pages of a performance indicator, scoring and so forth, to get a flavor as to were the outcomes, well, first of all, what were the objectives beyond just saying that in this case is security guards, but then is the outcome one that we expected, which was that the clinics were really satisfied and the clients were well treated, right? And that's kind of what we're looking for. It goes back to where we were saying that what we wanted to know was on the fiscal side, those monitoring reports are very helpful, knowing that there is a very active audit of the financial situation. And when there are problems, then these are showing up in the annual fiscal audits. But on the outcome side, which is really where we were looking for, trying to merge, did we do what we think it said it was supposed to do? That's where I know that we then got all the performance reports, and they're probably more in detail than we need. We need a response like I think you're going to show us as we go along, that it was very satisfactory. 30 clients got treated and they actually went on and did well, or they didn't do well, but we were able to work with 20 of them and they did, something like that.
Sure.
That's
Yeah.
kind of what we're looking for. We're not looking to see that you've done the extensive work that shows up as I know it's not totally in your department. That was one of the issues that we had here, was financing to be separate from the performance issues. And then we got all the performance issues put back together, but then it became really, I think rightly, that we should try to right size this so that there's less paper flowing through and more information that we could use, as the director pointed out. So
Yeah.
want to encourage us to continue to do that. And so I'm just giving you the first feedback, and that can change
Or
as we go.
or if there are problems,
I'm sorry.
or if problems surface,
Or it's problems.
if problems.
Yeah.
Yeah.
So
Yeah, and just to clarify, in general, our monitoring reports are usually for community-based organizations and not for some of these professional services, or what we call department operating support services. But in terms of the monitoring reports, we are happy just to give you the overall score. I know that we have ebbed and flow in terms of the level of detail that the commission has been interested in. I know there was a real keen interest in performance metrics. And so before we used to just give you the top score, the overall score. It's a 3 out of 4, and it's a satisfactory program. But then we had questions with the commission about, well, what are the metrics? And so then and then you guys are thrilled with the reports, but I think perhaps it sounds like perhaps it's a bit too much, and perhaps we could go back to just the overall score instead, and give you perhaps access to the reports without submitting
Yeah,
them every time. So
I think we're going to hit a happy medium in
yes,
this. So trying to see if we can do that and become more efficient.
yeah, looking
So,
forward to it.
Is it okay to move on to the next?
I was going to say if there were any other questions on the marina security itself, because we're just, I think, taking this opportunity from everybody's part as they're looking at something to give you some feedback on your new, pilot here. Okay, let's move on to well, unless anybody had any other questions on marina security, we can move on to the next contract. Okay.
The next contract is Project Open Hand. And this is a second pilot to share the new template with you, and that will be presented by Bill Bloom, the Director of HIV Health Services.
Good afternoon, Health Commissioners. I'm Bill Bloom with HIV Health Services. I'll lose contact because I reached that state between readers and contacts. I can almost read the paper. So if I'm looking down, I haven't lost my focus on you as well. So this is for Project Open Hand. The contract NTE is about 20.5 million. The difference requested is about 1.7.
Yeah, that's right. I'm totally lost here. That's we have so many papers. I think if Mark can get us copies. Well, I'm going to take yours away. Thank you.
Oh, I have
much.
this.
I'm sorry.
I have it.
Would you guys like me to do a rewind from that one? Yeah. Okay. Hi. Yeah, I put my readers on and I lost track of you all. Sorry about that.
Okay.
So this is for Project Open Hand. A total amount on the contract over the multiple years is about 20.5 million. The difference requested with this contract amendment is about 1.7 million for a 2-year period. The amendment is to be able to add anticipated Ryan White programs Part A funding for 25, 26 and 26, 27 year. Project Open Hand provides nutritional health for people living with HIV and AIDS through prepared meals, groceries, nutrition assessment, and other food and nutrition services free of charge to low-income clients. I think I'll stop there unless you'd like me to read some more details.
No, we'll find out. Commissioners, yes. Commissioner Guillermo.
So I think this is a better example of the new summary, because the flow of the information really ties together the fiscal, the programmatic, the budgetary, all of that. And so I appreciate the way that the information is presented, particularly, I think, number 2, the larger context piece. Which
you.
really helps, which in the future would be helpful, is the larger context in terms of the need, but also in terms of some of the, I think some of the anticipated reorganization of some of the programmatic categories and elements of the way that the funding is going to flow. So just, and I think this probably relates more to some of the behavioral health things that are coming forward to us, but I appreciate this. And just to sort of point out again, some of the things that are helpful here. Number 7 on the summary, breaking out the different sources of funding. So not just saying that it's federal funding, Ryan White, but actually the percentages. That's really helpful, because one of the questions I have is what happens if the federal funding goes away, which is, at this point in time, I think quite likely. So that is one question that I have, but it helps to know that there are several pieces to that funding. And so if you can answer that in terms of which of these might go away or might not go away.
Sure, happy to do so. And yes, the news has not been good. So, at this point, in terms of the budgeting process, what's at the federal level, what's been released is the presidential skinny budget, which is what they put forward out of OMB. And we were very surprised that in terms of the HIV care side, Ryan White's Part A, B, C, and D have been flatly funded. So we're not anticipating, usually the skinny budget is thus because it gets built up to be more robust. However, there are parts to Part F. There's a proposed elimination of Part F, which pays for dental services for dental schools, as well as special projects of national significance. And we're also looking at the possible elimination of another category of funding, ending the HIV epidemic, EHE funding. So the good news is for this set of funding that you see in front of us, it doesn't look to be in danger of a reduction next year.
If any of that goes away, does the department have plans to backfill particularly existing contracts, services? Because we've done so well with these programs, even though I think I do note that there was, again, in number 8, there was a 3 out of 4 scoring. So curious about that, but otherwise we've done so well. And then to have to potentially discontinue those services and those very well-experienced providers, particularly Project Open Hand, which has been around forever.
32 years. Yeah. I certainly hope not. I know that, it's kind of a larger decision within DPH and then, of course, the Board of Supervisors and the mayor. I know that they all are committed for HIV services as well for others, but I really am optimistic, Commissioner, at least for this set of services, that we won't be anticipating a reduction. But I will say if there were, so this is carry forward dollars. These are dollars that aren't expended in the contract. So we want to make sure to expend them so we don't pass it, but have to give it back to the federal government or underspend and then reduce a penalty in the following year. So this is a way we can ensure we expend all the dollars. So the contractor knows that the dollar amounts fluctuate and they understand it could be a small amount to up to a larger amount like 500K.
Thank you. And again, I appreciate how this is laid out. Sort of the sequencing of the information kind of makes logical sense in terms of, what's important and sort of going into it and what's coming out on the.
Thank you. Appreciate it, Commissioner. Credit goes to like a lot of people in this room. It went through a lot of iterations. I can't personally take credit, but thank you.
And then again, just for number 2, both the larger context externally and then internally as well. Yeah.
Okay, thanks.
Commissioner?
So is the Ryan White project part of what we're talking about here?
So Ryan White is the name of the federal funding. It was a very young man who was a hemophiliac, and he went public about 35 years ago. And he passed just before the legislation was enacted, and so it's named after him eponymously. So that's where that comes from. So these are federal dollars that are divided into 5 parts, and San Francisco DPH gets 4 of those parts.
So I was wondering, in that one, you only had a 2 for program performance. And I don't know if that's a question of timing or what that is.
I'm sorry, Commissioner, I didn't
May-
quite understand. You said we only have 2 parts. You mean the parts that are listed here? Is that what you're referring to?
Oh, maybe I'm wrong. No, you've got a 3, excuse me.
Are you looking at question 7?
3 unacceptable meat standards. Okay, sorry, bad reading.
Okay, no problem.
Okay.
That was my bad.
She was looking at the monitoring report. not
Okay.
Yeah,
Did you want me to address that then?
No,
Okay.
I misread, and I thought that you were getting a 2 for your performance, and I thought,
No, overall, they score very highly. Yes.
good. My bad.
No worries.
okay, thank you.
Okay.
And I appreciate the answer that you gave to my question also, which relate to the fact, if I'm correct here, intending to actually go out to bid. Is this the one? No, that was the marina
Yeah.
security. The question here had to do with the financing, which you answered and said was in the flat budget.
Yeah, the skinny budget at the
So
federal level. Yeah.
It's already in the budget then.
Yes, it's in the president's
That's
version of the
fantastic.
budget. Yeah, and usually that's the starting point, and then it goes to the House and the Senate, and the Senate tends to
Okay,
plus it
well,
up.
that's good to know that they've
Yes.
actually put that back in, or kept it in, I should say.
Yes, although other stuff has been cut, so I'm sure you guys will be hearing about that. Yeah.
Okay, thank you.
Thank
Any
you
further
all.
questions? If not, we'll move on to the next one, please.
Okay, now you're stuck with me and the old template. We'll go on to the 3rd contract, which is PRC Baker Places. It's their Ferguson house. And hang on just 1 second. Okay. This is a request to approve the 2nd amendment to this contract. It will increase the total contract funding by $1.79 million to increase the term of the contract by 1 year. The contract is an ongoing contract that we've had for years and years. And the agency had no findings on their fiscal report, which if I was going to be super proud of the department, this would be one of the areas, because this has been a lot of work with the agency over the years to stabilize Baker Places and PRC. So happy to report that there were no findings on the fiscal side. If you have questions, Max Rocha is here to talk more specifically about anything in the program.
Commissioners, questions? Yes.
On the monitoring port for the supported living program, I know that this isn't one of the ones that has the summary, the pilot summary, right? So I'm referring to the monitoring report. On page 4, number 3, objective, I received no points. And there was supposed to be a plan of action, but I don't see that.
Okay, I don't have that. Do you? Okay, we'll have to report back on that. I didn't. Sorry. Let's see.
It wasn't attached to the monitoring report.
It wasn't.
No.
Is it supportive housing or is it Ferguson?
So the supported living program.
Okay. So I'm going to hand this to Max.
On
I
page
think we're going to
4.
have to research it. I apologize. I totally missed
Yeah.
that one, but I see it. It's a plan of action for ensuring individualized service plans for new clients are in place within 14 days of initial assessment. I believe that the system as a whole has been making a lot of training and work to help, because it's not unique to Baker Places to meet that objective, but. Yeah. So I
So
got
this would
that.
be an example of if we get the summary and sort of the pilot, if there was a specific area where there was, no points and
Right.
everything else was good, that would need to be pointed out, I think, in terms of, are there any, things of note? Even though overall the monitoring report is good, there's a one that has, I think this one seems to be pretty significant in terms of, individualized service plans. That's an outcome of the process. So,
Yeah.
so anyway,
okay.
just a
Yeah, yeah,
suggestion
so-
that this is something that if there's a plan of action, we should probably have that noted on the summary. And then we should know what the response is.
Right. Plan of action, I'm going to say 2 or less, 2, 1 or 0 of points that it would generate a comment. Okay. Thank you.
Yeah, I think that's a good one to point out that the one thing that is showing up on these are plans of correction.
Yeah.
Not just financial, but project wise.
Mhm.
And those would come under, I guess, your number 7 or 8 or whichever the number it is. Is there a significant issue?
Sorry, I'm having trouble hearing you. The plan of action would have what?
Oh, under 8.
Good afternoon,
Yeah,
Commissioners. My name is,
We're just pointing out comments that if this had a,
Yeah.
that I think Commissioner brought up that it was important that be items noted, especially if we're asking for a plan of correction
Right.
and whether the plan of correction was satisfactory or not.
got it. Good afternoon. My name is Max Rocha, Director of Systems of Care at Behavioral Health Services. Joining us today online is also Ryan Fuimano, our System of Care Program Manager, who can speak to the plan of action. May I invite him to speak from online?
Please.
Sure.
Hi, Commissioners. This is Ryan Fuimono, Program Manager for Substance Use Services Residential Programs. I just wanted to confirm that we are in receipt of the plan of action and we can definitely forward it to you shortly, or I can read through it if that's what we want to do right now.
Well, I think all you have to do is give us a summary of what the plan of action actually said and whether you're satisfied with it.
Yeah, the plan of action pretty much just details the process in which they're going to ensure that clients are provided with that ISP or treatment plan as it is within the given time frame, and we as a system of care are satisfied with it.
Okay. Is that satisfactory?
Yeah, but are you satisfied with the one that you got from?
Well, he seems to have said he was satisfied.
Okay.
That's what I said.
Yes, as reported from Ryan.
Okay.
Thank you.
Any question, Commissioner? No, okay, then, wanted to note that even on the, matrix that we have, noting the type of contract, that this is cost reimbursement or, otherwise is really very helpful. So, thank you. We'll move on to the next item, please.
Okay. Okay, the next contract before you today is the Edgewood Center for Children and Families. The requested action is the approval of an amendment with Edgewood to increase the total contract amount and to extend the services through 2030. So that would be a 5-year extension. This contract covers 2 services, the hospital diversion services and the crisis stabilization unit. And one of the questions that you asked was more information about the type of services that are provided. So within that, the type of services really cover the standard portfolio of mental health services, but this includes boarding care, assessment, crisis intervention, individual group, family therapy, medication management, and the same addition, essentially, for the partial hospitalization program. The one thing to note is that the contract detail that's provided today for the hospital diversion program breaks it into 2 categories of funding. 2 categories of programming, whereas before it was collapsed into 1 category. And so that's what it's going to look like in the new contract, but there's still some negotiations going on, because one of the things that allows the splitting apart the 2 programs is a report that will be developed in Epic with CalAIM and the outpatient and the rate changes that will allow the ability to report these separately. And in so doing, reporting those separately, there's discussion going on about the rate and the ability to switch some of the services over to fee-for-service and not retain them as cost reimbursement, but there wasn't reporting capability before. So I just wanted to let you know, it's not going to change the total funding of the contract, but that is one change that's on the horizon. And it sort of leads back to what Dr. Tsai was talking about with, the reviewing cost reimbursement and fee-for-service. So I think that answered the question that you posed about this contract, and you actually saw this contract just a year ago. So, but we are taking it to the Board of Supervisors for this full expansion, and so we definitely wanted and needed to bring it to you first for comment. So please let me know if you have additional questions.
Well, thank you for the response that you also provided. And I think that shows some of the issues of lumping sums together and trying to figure out what it was. And it's nice of you to actually have told us. And again, letting us know that whether it's cost reimbursement or fee for services, even on the matrix has been helpful.
And the other piece is they've done well on their fiscal. There wasn't any findings on their fiscal monitoring, and they don't have a plan of action for their monitoring report. So,
Yes. So, commissioners, further questions? No.
How many children does Edgewood serve in a year or in a day or however?
in this program or in the,
In this program?
okay, I'm gonna defer that to Farah Farnaz, who is the director of the Children's Youth section of Behavioral Health Services, because I don't have more information beyond what's in the questions that we provided. Oh, there you are. You're online.
I'm here. Hi, everyone. I'm Farah. For the crisis stabilization unit, we're actually working on increasing utilization over time. So right now, for this fiscal year, it's an expectation of 103 youth. Next fiscal year, we're going to move it up to 160 and continue to work on those placements. For the hospital diversion, inclusive of a step down to a partial hospital, it's 30 youth a year in the partial hospital program, minimum 2-week stay, maximum 4-week stay. They average about 3 weeks. And of those 30 kids, about 12 of them step down to the partial hospital program, where they are there during the day, but not overnight and on the weekend. And we have 2 of those beds.
Thank you.
Thank you. I also found it helpful. We'll have to be somewhat careful when we look at unduplicated clients, because under each of the programs, some of them are duplicated in the sense that the 12 in hospital diversion apparently are part of the 30.
Just the 12, yeah, just the 12 step down from Parcel Hospital. We're finding that some of the kids that are in the hospital diversion program, which is 24/7, averages 3 weeks, aren't ready to step back to their outpatient program or their intensive case management wraparound program, but they don't need to have the full dosage of staying 24/7. And so some of those kids, just 12 of the kids, step down to the partial hospital program where they're there just during the weekday.
No, that's fine. I'm just alerting us that these are not totally unduplicated when we're
Yeah.
reading across the columns. That's all. Thank you. We'll move on to the next one, please.
Okay, the next contract before you today is Richmond Area Multi-Services, Inc. And this is their PAYS program, which is Personal Assisted Employment Services. This is an original agreement that we put out to bid. And so this contract is to continue the services that were previously provided. This is a partnership with the Human Services Agency where we're helping them with their individuals who are enrolled in PAYS, who then receive mental health or substance abuse services to reduce barriers on the HSA program or HSA side. You can see here the different services that are provided under the service description. And essentially, we're creating this new contract. And the RAMS as an agency has no fiscal findings. They're done really well fiscally. And then one of there is a plan of action on this contract, which is related to the fact that there's not a fire clearance. And so that was one of the questions that you asked, if that had been resolved. It hasn't been resolved yet, and it's underway, but RAMS is in a site that the Human Services Agency leases from the school district. And it's HSA that is working directly with the fire department to get the fire clearance. So RAMS can't get that fire clearance themselves for this HSA site. So that is the plan of action, is they need a fire clearance, and that's the outcome, is that it's being worked on right now or continues to be worked on with HSA. If you have other questions, Max Rocha is here to answer.
Thank you. No, we've reviewed this program for many years. I find it very interesting that the reason that it's out of compliance is because of other city agencies that haven't been able to clear this fire clearance. And that's sort of distressing that we then ding the nonprofit agency for not doing it, but it's within the city that it hadn't been done. So
Yes, it's a way to keep track.
please go ahead.
Just a clarification, so the services provided under this contract are part of a continuum of the larger program that the city has for
For
these?
PAYS, yeah,
Yeah,
for
for
people
PAYS.
that are in the PAYS program through HSA.
So they identify the individuals that
Yeah,
are, and
they
they
identify-
provide this.
Correct. They identify the individuals who may be having barriers. I believe this, Max can correct me, but I believe it's if they're experiencing a barrier to being able to work that might be related to a mental health or substance abuse issue, then they're referred to DPH, who provides services, direct treatment services through this contract.
So just in terms of the overall, I guess, outcome of any one individual going to the program, we just evaluate the objectives related to the part that we provide. Is that correct?
Correct. Yeah.
Thank you.
Let's move on to the next question then. The
Okay.
next contract.
The next contract is excuse me, is Health Right 360. This is a contract with HIV Health Services, and this in this contract, Health Right 360 provides program administration services essentially for the Department of Public Health and specifically for HIV Health Services section, managing some of the components of the grant-funded programming. So the request is sort of a model of efficiency, which in the fact that the request, it wasn't that long ago that you saw it, but what we're doing here is requesting an extension to maximize the term of the contract through its RFP solicitation authority, and then adding the corresponding funding to the contract to support it through those years. And I noticed the question about HR 360 and their fiscal issues, but they don't actually have any fiscal issues. They are a very strong, financially stable vendor. So, and then in this role, actually, it's not a direct treatment contract. So I don't think that was an actual issue, or if it was, I wasn't sure where you saw that.
Yes.
So
Please.
this is another one that's funding source is the Ryan White Part A in addition to general fund.
Yeah.
So we were, in the previous one, we were assured that funding was in this year's skinny budget.
Mm-hmm.
But how do we know that this is going to be continued all the way through a 2032 contract? And again, if the funding goes away, are we going to backfill until 2032, or I'm not sure how this.
Beth, could you please turn off the sound on your computer because you're reverberating on our side? Thank you.
Yeah, do you want to?
I think Beth was she trying to answer?
Start either way.
Oh, yeah, I just saw her on the monitor, so I wasn't sure who was going to answer. Yeah.
Beth, do you want to start or shall I?
Oh.
Now we can't hear her.
Yeah, so Beth, it's not that you're you can unmute yourself. It's that the sound on your computer was from us. The sound of the meeting was reverberating on our end, but please unmute yourself and you can talk. Just shut the sound off so we're not hearing you talk to us.
I will be brief. I'm Beth Neary from HIV Health Services. And actually, I hear the sound issue. I'll let Bill answer. Thanks.
It's okay now for us, please. Beth, it seemed to be okay. Go ahead and answer.
Shall I answer? Well, let's see if connected. We work together very closely. So, the majority of this funding actually is general fund. It's not Part A. There was a small part of Part A that was, again, for the carry forward dollars for a specific training. But you are right. The funding is, not every year the funding can be less or more. We don't have any indication that they would be eliminating the programs, unlike other programs like Ryan White Part F, which is not part of the funding or EHE. But you are correct, Commissioner. We don't know that every year we'll get the same amount of funding.
So then why would we, if we're not sure about the funding, I understand wanting to extend the contract with regard to the authorization, I guess, timeline. Right? That's what it says. But again, does that obligate us if the Ryan White funding goes away to use general funds?
I think when there's a cut, the process has generally been that either the department, with a direction from the mayor would just use to fill it, or sometimes there's advocacy within the community, but there is not a guarantee that when the funding source is reduced or eliminating that the funding continues.
So just a process question. So would it make any sense to not extend the contract for 10 year or for another through 32 and maybe a 5-year timeframe instead?
You know, I think the reason for it is really contract efficiency, and others can speak to it as well. It could be done for less time, but I think the providers for many years, because Ryan White for us has either been reduced or stayed flat funded, because at a national level it's flat funded, and then other jurisdictions aren't doing as well as San Francisco in terms of preventing new infections. So it's formula driven. So we're kind of used to the drill of reduced funding. So I think the providers are aware that a multi-year contract does not guarantee funding for, many years out. Yeah.
Well, also, Ms. Ruggles, can you talk about the 30-day cancellation or the right? There's something in the contract where at any time the DPH can cancel, right?
If we don't receive the funding, we're able to reduce the funding. Here's where efficiency doesn't pay off, because it's kind of jarring because it's so far into the future. So, but the reason that I asked this, why are we doing this? You just went a year ago. And you know how all of our contracts have a contingency in them. It's 12%. And so once you use up that, then you have to come back and amend. You have to amend the contract, add money, add money. It's very often the nature of Ryan White funding, very, very common that there's carry forwards from other Ryan White funding sources, and they add it to contracts so that they can spend it down or, fund needed items. And so in this instance, that is what happened, and they've used up the contingency so they can borrow into the future years for the funding authority. But instead of doing that, they're being the contracts office extremely responsive and responsible and adding the full contingency and maximizing the term. So I get it that it's weird because we're never that responsive, that far ahead, but that's what they were doing. They were fixing the contract so that they have a contingency so they can address and incorporate these add backs that happen all the time, that require us to do amendments all the time simply to add the carry forward. So I think it's not a risk if we don't receive the funding and it needs to be reduced. We don't have the funding. We are not obligated to continue a contract.
Even in terms of the general fund?
I think it's the same thing. If there's no funding, we don't, yeah.
Okay, thank you.
Mhm.
Yeah, so I just want to remind, it's in the boilerplate, isn't it, that there's language saying that that the city can terminate a contract within 30 days, 45 days, something like that?
Right.
Okay.
I don't know.
Not that I'm advocating cutting funding, but it's an important question, I think, given the length of the contract term that is being requested. Yeah.
Yeah, I still am somewhat concerned that we are extending a contract which doesn't expire until 2029. We've got a lot of retro contracts that it would seem to me staff could have worked on instead of extending an already extended contract to 2029 through 2032. So I'm not sure I understand the rationale. The commission had a rationale of really not wanting contracts to be beyond 5 years, even though we could write a 10-year contract, which the commission agreed we'd write 10-year contracts, but we would like to review it in 5 years to be sure at a minimum that it got reviewed and not just have a 10-year contract go on. This actually seems to subvert that. And I still don't hear a reason. The only reason I have here is it's more efficient. But the work of renewing the contract is the same whether it's in 29 or well, might not be. I mean, we don't know. But as versus now. And we've had issues of Health Right 360 in the past with its financial issue. We've had newspaper articles, in regards to other issues with them. And here we are then looking like we're renewing a contract that didn't really come due for 3 more years or 4 more years, to extend them for the full 10 years. So I don't know why this one was picked out and why we didn't then do all of them like that, or why this one, for whatever reason, suddenly has a renewal that goes all the way to 2032.
So the reason is that the contract analyst was being supremely efficient. And if they weren't doing this and maximizing the term and using a shorter term, they would be coming back now to amend the contract because the contingency is gone. It's been used up. So the only way to add funding, the only way to support the carry forward funding is either is only to add funding. So they're coming back, adding the funding, knowing that this will keep happening. Instead of doing 3 more health commission, they're doing 1 because they know that they're already out of money. If they want to spend the current year budget at the current level, then they don't have enough money from the contingency. If this is a problem, I mean, I think it's done, but if this is a problem, we can reverse it. I get it. I hear what you're saying. I had the same questions, but I felt confident with the response. I get it. It's a little odd to be that far ahead, but they decided instead of having 0 contingency and no ability to fund carry forwards, which happen all the time with this funding source, that they would ask for the maximum number of years, add the full 12% contingency back, and seek certification approval.
And I believe Ms. Neary would like to comment too. She's raised her hand. Beth, it's okay if she gives some comment. There's another staff member who has some comments.
Comment on what?
I think she's trying to respond to your.
Oh,
concern.
I thought Michelle did.
Michelle did. Okay. All right.
But that's fine if she wants to also reemphasize, but you know, that wasn't in our text here in terms of trying to understand what you meant by efficiency. But be happy to hear further explanation.
Okay, so I'm Beth Neary from HIV Health Services. And the reason why this started now as opposed to in a couple of years is because we needed to extend the role of two of the positions funded on this with ending the HIV epidemic funding. So we needed to extend those for the next 4 months on general fund and the 12 months beyond that. So essentially we needed to plan for 16 months, and that alone brought us over the limited amount of contingency we had left. So once we were opening up the contract to do that, since we'd already been to the Health Commission about a year prior, we thought we should go ahead and do the whole extension now, all of the points Michelle made, to try to do the foreseeable things at the same time. So essentially, it really was first to take care of the first 4 and 16 months. And the reason why that arose, and we hadn't planned for that previously, is because it relates to a state-run database called HIV Care Connect that was originally set to go live about 2 years ago. And they postponed quite a lot, and it just went live on April 7th. But there's a lot of quality assurance and remaining manual data entry work to do while we set up a new import. So the timing was a little unpredictable until now, and we've just now funded it through then. And then this may be a little more detailed than necessary, but the funding notice that we had given the vendor actually only went about 1.5 years out. It didn't go all the way till 2029. So while the contract was till 2029, we didn't have in the contract the full detailed budget that would then create, invoice templates for them and ability to bill. So we're also extending the budget to the maximum RFP so that they can build the budgets. We can review them now, and they can amend them if needed at future years. But generally speaking, they're pretty stable budgets. But we didn't include the full amount in the contractor budget actually beyond these 16 months for the added part.
Well, thank you. That explanation actually is helpful. And if staff and Michelle has accepted that as an explanation, I don't have further questions about this one. Any other questions?
So just a comment in terms of maybe the future presentation using the pilot, the summary, that this is one of those where, again, the sort of funding explanation could be maybe broken down a little bit more, or the purpose could be broken down a little bit more. Yeah.
Oh. Hello. Yeah, I think this is a great use case. I think the Excel sheets and the details in this way don't really pull out those first order questions. The explanation that you just got makes a lot of sense once you go through that. And so I think in the future, that whole pilot summary form, the first box is what's the context for this? Why do we have a contract before us? Those are the types of things we want to make sure that how our teams internally are thinking about things together and how we're communicating that as well. So that's why I'm very optimistic about moving towards calling it a pilot, because it's a different way of how we represent the rationale behind contracts. And certainly we're looking forward to feedback for how to refine that. But I would love in the future, as we migrate towards that, these discussions start to feel even more efficient, because you can get that context up front and know that right away, which probably obviates 15 questions you might have, but for not having that context. And so that is my hope for this.
Thank you, Director. That was very helpful. We'll move on to our next item, please.
Okay, thanks. None. Okay, so the next contract is a Shanti project. This is actually a new original agreement that is continuing existing services. So the new original agreement starts on July 1st, 2025, and it will continue. It's a 4-year contract to continue the existing services. The existing services are a combination under the Cancer Navigation and Survivorship Program, serving individuals that are identified here, but low income, underinsured, underserved, educationally disenfranchised. The goal is to begin service with the individuals from the moment of their diagnosis, and the program provides care navigation, staff volunteer match and support hours, wellness and survivorship support for the individuals. And let's see if I didn't answer. Yeah, I think that covered the questions that you had, but in any case, it's an ongoing service for under a new contract, and there is staff here to speak to your questions about the services and how to perceive them versus direct versus not direct services. So I think that was a question.
Yes.
Good afternoon, Roland Pickens, Director, CEO of the San Francisco Health Network. I'm the program manager. Barbara Cicerelli is on leave, so I'm presenting in her absence, and I'm joined by Sabrina Robinson, COO at Zuckerberg, and Arlena Monder, Nursing Director at Zuckerberg, because this is where that program is based. As Michelle said, this is an ongoing service. It's been provided for more than 20 years. Those of you who are familiar with the Avon Breast Center that was sponsored by the SFGH Foundation many years ago, had a very important component of cancer navigation for women with breast cancer. The program has now grown over the years to not only include breast cancer, but now it's being expanded to all types of cancer, and is also being expanded to the first time for men. And so that represents the new service. As Michelle said, the proposed contract is for an additional 4 years. It adds on an annual basis an additional $86,463 to pay for an increase in staff from 4.9 FTE up to 5.7 FTE. And again, the services are navigators to help cancer patients go from appointments to appointment. There are also cancer survivor groups and case navigation services. So happy to answer any questions.
Thank you. Questions then on Shanti? I mean, you answered, or staff had answered my questions already in terms of it going ahead, and I think you put it into context that it, it's part of the Avon Health Center programs.
Right. It started at Avon and now lives in the oncology clinic at Zuckerberg. So, this has started with Judy Luce and Donald Abrams and that group from many years ago. But Barbara Cicerelli took it over from Diane Carr, who was the original founding nurse practitioner who set up, again, breast cancer navigation services, which are now expanded to all cancers.
Sure. Okay, questions? Other questions? No. Okay, thank you very much and for the explanation, and we'll move on to our next contract.
Okay, the next contract is for Conard House. This is for one of their programs that's called Representative Payee Program. This went out to bid and was pulled out of a larger contract as its own new standalone contract. It's a 4-year contract, and it provides, as I said, rep payee services. The not to exceed amount is the amount of 9.9 million. That you had provided a couple of questions, which hopefully, if you didn't get a chance to see, the average amount managed per client ranges from $473 to about $1,200 per month, and it averages about 8 transactions per month. There was another question about in their last fiscal report, fiscal monitoring, that they had a late audit and cash flow finding. So the late audit, they were late. You're supposed to turn it in within 9 months. They did turn it in October 2024, but the monitoring period had already concluded, so it wasn't noted, but they did turn it in. The current year, fiscal year, or the last year, the fiscal year 23-24 fiscal and compliance monitoring is currently underway, and the Department of Housing and Homeless and Supportive Housing is the lead agency, which means that they're conducting it, and and because it's underway right now, we don't have an answer to whether or not they have provided their audited financial statements yet on time. So we'll know that soon, but we didn't know it in time for today because it's underway. And then our Wasim Samara added some additional detail. He works in the business office of contract compliance and is the person that reviews the audited financial statements. So just to give a little assurance, he noted that at the same time that there was a negative cash outflow, the agency's cash and the agency's cash reserves were low, they had other financial indicators that were positive, including a net income surplus and on an accrual accounting basis. So in his opinion, and he reviews all the audited financial statements, he believed that the negative cash flow appeared more to be of a timing issue that would be resolved over time. So we can report back to you if you'd like sooner rather than later on what's happened if they were able to turn in their audited financial statement on time this year. They claimed in their response back to us, it was a timing issue for them because they were in the process of buying a couple buildings, and that delayed, I guess, finishing the necessary accounting, but I only am commenting on what they provided. If you have questions, though, about the contract at all, we have staff here that can answer your questions.
Good. Commissioner Guillermo.
So I appreciate the status update. And it still makes me anxious to approve a almost $10 million contract to an agency where we don't have current indications of their cash flow status and audit. So their current audits, how soon is that supposed to be coming in?
I will turn this to Wasim Samara. I believe it's like real time right now that they're working on it. There's Wasim.
Good afternoon, commissioners. So yes, it's actually they've already sent the documents. I had a quick chat with the lead in the Department of Homelessness and Supportive Housing. So documents already there. Now it's a matter of the lead monitor will, schedule kind of like a meeting with all the participating departments and divvy up the assignments, and we will start our review. So it's probably around a week or two, including back and forth if there's anything missing, questions, that sort of stuff. So I think within like a week or two we should have more information. And just to add a little bit about the financial situation. So yes, there was how Michelle Ruggles indicated, there was a cash outflow. However, other financial indicators were positive. And what's going to happen now is kind of this year will determine, you know, are things getting better, or are things, continuing, like, are they continuing to do their audit late, or was it just a one-time thing? Is the cash outflow gonna kind of correct itself, or is it gonna continue, going in the negative direction? And I think if this year they persist with the findings, then that's when the agency gets elevated to the Controller's Office Corrective Action Plan. So they get elevated to, elevated, it's called elevated concern. And this is where the department starts to intervene, more, provide technical assistance, have regular check-ins and meetings. But again, based on the finances we saw, even though there was a cash outflow, there's no there's no like disaster gonna happen in a year. I mean, it's more of a long-term trend. If that continues over time, then the agency would have an issue.
Would there be, I guess, a difficult situation for this particular agency if we waited until next month when the monitoring or the documents have been reviewed by all the partners and provided a more definitive documentation of their status?
The contract actually was certified because this is a retroactive contract, but we could certainly come back and bring the results next month. And if there's, if it's showing something that is concerning, then we can go back in and look at changing the contract.
So that meaning if it was certified, then we.
It's certified right now. This is a retroactive new contract. And since it's continuing, we don't delay the certification because it just delays payment. So, I think the best opportunity is to come back and report and then revisit the term and see if there's something that we should adjust officially if it's not looking positive.
One thing to add, though, is that, because this is a retroactive and basically they're providing the service without getting the payment. So that usually part of the reason why on a net income accounting basis, they would have a positive, but then on a cash flow, they would have a negative. So, the more delay we do, basically kind of adds to the problem.
What we could do is, as suggested, for them to come back and report the results of the audit
Okay.
so that we could look at whether or not there should be other action taken.
Yeah.
Okay. We definitely can do that.
Okay, good. I'm not clear what they actually do. This
They-
is a large amount of money, and the clients have small amounts of money coming in, about $3,000 maybe.
It's a lot of clients. They manage.
They have a lot of clients.
They manage the money for people, let's see, enrolled in people that need it, money management to make, they'll hold their money and pay their rent. and pay the funds on behalf of the client and then give the client, the balance to have as their own funding. But they do it on behalf of the CAP program at Human Services Agency, the County Adult Assistance Program, as well as other referrals from the mental health system of clients that would benefit from having money management through a representative payee. So that's what they do, is that money really represents the money that is going to the people, the clients, not to them. Do you want to?
Augmenting what Michelle just shared out, so they currently have an active cases of about 700 clients any given month, with approximately 8 transactions per client per month. So these money management services pays for the bills, and also with, distributing debit cards. Yeah.
Oh, so they actually take over payments of bills
Correct, such as rent, utilities, and
for
so
these
forth.
clients, and then are the clients the same stable block all the time, or how do you qualify to be a client to get this financial
So generally, these
manager?
Yeah, so these are clients identified through Human Services Agency as well. So some of them are conserved and are in need of this type of service.
Oh,
Yeah.
okay. So, and so it's not just 700 in that year. It could be at any one time, there's 700 doing that.
Correct. I confirmed that with the agency earlier today.
Okay.
Yeah.
Any other questions? If not, thank you.
Thank
We'll
you.
move on to the next.
Okay, the next to the last contract is UCSF Health, Community Hospital, St. Mary's Medical Center. It's the Macaulay Treatment Center is what it's been called in the past. This is a new original agreement to continue the existing services that are provided in this contract. And it is a contract to provide intensive outpatient services in an education setting for students living in San Francisco and identified with an individual education plan. You had some questions about this contract, and so we provided the answers, but we also have Farah Farnaz here, the Director of Children, Youth, and Family Services, but who can go into a lot more detail. But the program provides a standard portfolio of outpatient mental health services, and then plus services that are specific to the educational component of the programming. So this is included starting on page 3 of the questions that you had asked us to answer, but so includes assessment, plan development, individual therapy, and then the list goes on, medication support, and also classroom help provided in the classroom. So I will turn this over to Farah, because I imagine if you have questions, it's about programming.
So we're moving from a cost reimbursement to a fee for service program, but with the same amount in the contract.
Yes.
And so you've all assumed that then it would be very similar to the cost reimbursement? Or
Well, this was similar to contracts that shifted mid-year because of CalAIM payment reform. But yes, we actually, for the fiscal year 24-25, their rate was $648 an hour, and that was inclusive of an intensive pass-through rate and a one-time support to support the program transitioning. This is a program that relies on referrals from the school district. And it's the highest tier level of service before going to residential. So these are kids that are chronically truant, hard to engage. So that shift mid-year, we supported them with a one-time pass-through, and the rate's going to decrease to $461 dollars an hour next year.
Okay.
We are working to, since they've shifted over to UCSF Health and a lot of the leadership has turned over in staffing, there's been significant improvement in the partnerships and placements with the organization and the school district.
So by shifting it to UCSF Health, you improve?
The shifts was happening. Leaders, I don't think it was the shift. Don't quote me on that. It wasn't just the shift to UCSF Health, but at that time, there was a lot of leadership and staff turnover, and the leadership in place have been working really closely with DPH and the school district. And so you'll see, well, I'll let you see if you have any questions.
Commissioners, questions? No. Is it
questions?
going to be better? Okay,
The story's yet to.
no, well, it's a service that has been needed and sounds like it's going to continue to be there and even improve cost-wise. So thank you. We'll move on to the next contract item.
Okay. The last contract on this contracts report is Salvation Army Harbor Lights Residential. And I think we could have presented this two different ways. So I apologize for the confusion of the way I picked. But what this is this is a new contract. It's a new original agreement. It is both continuing existing services and it's adding additional of the existing services. The reason I didn't choose to include the original contract is because it wasn't ending, but now I think it would have been easier to explain it the other way. But the other contract is continuing, but it's grant funded. And what we did though is pulled the non-grant funded 22 beds out of the existing contract and added it into this new one. And this new contract is authorized under our bed ordinance. And what it funds is 22 residential treatment beds, which we pulled out of the old contract so we could make them more permanent, not one time, and not be mixing the fully grant and general fund. So we pulled out the 22 beds, residential treatment. We added 22 residential treatment beds to increase capacity. And then we added 10 withdrawal management beds to the old contract, or the ongoing grant funded contract also provides withdrawal management. So it's not a big shift for Salvation Army or for what we're buying. It's just now it's in this new contract. So sorry about the confusion in the presentation. We answered your question. The original contract has a term of February 16, 23 through March 1st, 2026. And that full contract amount is $6,552,000. It just didn't seem very apples to apples to compare it, but nonetheless, there it is. One thing to note is that the current beds in the other contract are $115 per bed per day. And then this contract, the residential treatment beds and the withdrawal management beds are $148 per bed day in the proposed contract. And that increase is supporting DPH's requirement that they have a licensed practitioner and that they have, and we funded dedicated administrative time to ensure that the data entry into Avatar could occur. And if you have additional questions about that or this, Max Rocha is here to speak to this contract.
Sure. Commissioner Guggenheim, I just saw your note here. You have a question? Oh, you can't.
And
Okay.
commissioners, just to note, you have two new contracts and we have 25
Yes,
minutes
I
of the
know.
meeting. Yeah.
Yeah.
Okay.
Commissioner?
No.
No questions. So I think we're prepared to consider a motion for acceptance of the contract report.
To recommend to the full
And
commission.
recommend to the commission acceptance.
I'll move recommendation to the full commission.
Is that a second?
And then let me check quickly, any public comment in the room on this item? Okay, please go.
Okay, so all in favor, please say aye.
Aye.
Great. Thank you so much, Ms. Ruggles and everyone who presented. Item 4 is a request for approval of a retro contract with Seneca Center.
And just to say of the upcoming presentations, this first one is using a new template, and then the other two will follow the existing template.
Hi again, Commissioners. Thank you for hearing this item today. My name is Farnaz Farman. I'm the Director of the Children, Youth, Family System of Care and Behavioral Health. And with me today remotely, I think she's still on, Erica Kellenbach, who is the Regional Executive Director for Seneca, including the San Francisco programs. I'm here to request for approval of a retroactive new contract with Seneca Center to perform multisystemic therapy services, or MST. The total proposed agreement amount is for $3,060,284, which includes a 12% contingency over a 3-year and 6-month term. It's important to note that there is currently no DPH general fund being used to deliver the MST services. Aside from the federal Medi-Cal portion, all other dollars, general fund dollars, come from the Juvenile Probation Department, or JPD. The contract payment structure is fee-for-service and was obtained through Sole Source Authority. For background and context, the Juvenile Probation Department, or JPD, sought out grant funding to support an evidence-based treatment for juvenile populations. They conducted a solicitation and Seneca was awarded. JPD contracts the funds for training, consultation, and evaluation costs, and DPH's contract covers the cost of delivering this specialty mental health service, inclusive of ramp-up costs for fiscal year 24-25. The contract provides MST services, which is an evidence-based, intensive family and community-based treatment program that addresses all environments that impact high-risk youth, such as home, families, school and teachers, neighborhood, and friends. The model is evidence-based in reducing criminal behavior, out-of-home placement, and improving family functioning. The Children, Youth, Family System of Care has a central access hub embedded within and in collaboration with the Juvenile Probation Department, and all referrals to this program come through this hub. MST is a service that sits within our intensive services continuum of care, and it bridges a gap between community-based supports and more restrictive interventions like residential placement or juvenile detention, which offers a viable alternative to out-of-home placement when appropriate. The target population include youth with chronic truancy, curfew violations, substance use, and defiance. Additionally, youth who are at risk for out-of-home placement and whose caregivers are able to commit to an intensive family-focused model. The model does require caregivers who are willing and able to participate in approximately 2 to 3 sessions per week in the home and implement strategies for supervision, structure, and behavioral change. It targets 30 youth in the year. However, for this fiscal year, given a late launch and ramp up, 15. And each youth, the model is minimum 3 months and maximum 5 months. And there's 2 to 3 weekly contacts and sessions that occur completely in the community school home per week. I know I've provided a lot of information to you in the new pilot format, so I'm happy to speak any further to questions you have. And I know Erica's on the line and happy to answer any questions too.
Commissioner Guillermo?
Just a comment on, again, the excellent use of this new summary sheet. So and I know you read from it, but I think in the future, you probably don't have to.
Okay, great.
Yeah. But good qualitative flow on the information provided. So again, so then my only question is, just in terms of the prior performance, I guess, of this Seneca.
Oh, great. Yeah.
Agency or organization. I know that they're operating in another county. And
Yes.
have we heard more than what's in here in terms of their performance.
Yeah, luckily Erica could speak to that. There's only 2 providers of MST across the state of California, and Seneca is one of them. They've had a 20-year collaboration with Alameda County. While we don't have any performance outcomes since it's newly launched this fiscal year, they are a large provider of multiple services and they are a strong performer in the department. But Erica, can you speak more to your success in Alameda?
Sure, absolutely. Good afternoon. Yes, we've been operating with Alameda County in juvenile probation for going on 20 years now. Our main success point is that over 95% of the youth who complete MST remain in the home and have a successful completion of the service. So that means that they have no new arrests, that they are in school full-time or working full-time, and they're living with their relative caregiver or parent.
I think this is something that the full commission, particularly Commissioners Christian, Gerardo, and Salgado would like to hear. So it's just important to have that in the minutes, I think, in terms of what they're providing, yeah, and their record.
Okay, are there further questions? If not, then we'll entertain a motion to recommend to the commission.
Any public comment in the room? All right, please vote.
All in favor, please say aye. Aye.
Thank you.
Thank you.
Thank you.
Item 5 is request for approval of a new agreement with 5 key schools and programs.
Good afternoon, Commissioners. This is Max Rocha, Director of Systems of Care, Behavioral Health Services. Presenting you today is a 3-year contract new to us with 5 key schools and programs. Joining me today is Director Yoonjung Kim, Residential System of Care. Also acknowledge 5 Keys leadership presence here with us today. Brandy Marshall, Deputy Director of Housing, and Deputy Director Kim Duong. This is a 3-year contract. It's about $4.4 million, with year 1 of note is from November 15th through 2026, and about $1.48 million for years 2 and 3. Primarily, the services is for offering supportive services to clients in emergency stabilization units. What we mean by stabilization units are supportive single room occupancy units across 4 sites in San Francisco. In about 6, we have about 59 rooms available through this contract. Supportive services means case management, housing navigation, and also linkage to care. The performance objectives include successful linkage to related public benefits within the first 7 days of intake. And then also the second performance objective is to make sure clients are discharged to the next level of housing upon completion of the program. Happy to answer any questions that you have.
Commissioners, questions? Yes. Commissioner Gildan.
So do you have any figures on or stories or anything on the success of these?
I wonder if I may invite 5 Keys to give a success story, if available.
Yeah, I think the previous contract from Seneca and the report from the other county was very helpful, and the performance metrics that we establish here still continues to be processed. So I'm wondering how they're able to actually get information that sometimes in our contracts we don't seem to see.
So the performance metrics will be provided by 5 Keys at end of completion of the first year. We will also be doing regular monitoring with 5 Keys to make sure the units of services and unduplicated clients are served within progress.
Okay.
So the performance metrics is new to us, and wonder if Commissioner would like to hear a success story.
I'm sorry, what was the last thing you said?
Commissioner Judy?
It was, you were offering a success story?
Uh-huh.
I think the commissioners are looking to, if I may help kind of clarify, they're looking to see why they would want to fund this and proof that there are examples that this vendor does a good job in some way. So you're pointing to the vendor, but they're also pointing to you to say like, how can they trust that this is a good business decision to move forward?
Correct. So as evidenced by the performance metrics indicated and the duplicated client counts that we are requesting them to meet. Yeah.
Okay. I think that, do we have questions?
We're just wondering, do we have evidence of their performance in other counties? You know, similar to Seneca, you indicated they've operated in Alameda County. Five Keys has operated where and how successfully, or?
We have operated,
Please give your name just so they know who you are.
hi, my name is Kim Young, Deputy Director of Housing. We operate, I want to say 10 shelters and permanent supportive housing sites in San Francisco, 3 in Alameda County.
You say you're operating the shelters or you're providing, this contract is to provide support services?
Yes, we
Which mean is that you're actually there providing support services, you're not operating?
we operate and provide case
Oh,
management
you're
services
operating.
at all of our sites,
Okay.
except for one.
And in this case, you're just providing support services?
Yes, we also operate, we provide meals, we provide security, 24/7, after-hour care.
So that would be all part of the package, not just support? Okay.
Yes.
Commissioner Guggenheim, any questions beyond that? Okay, that's helpful. Okay. If we have no other questions, a motion to recommend to the commission approval of this contract is in order.
I'll move to recommend approval to the full commission.
Okay.
Second.
Is there any public comment on the item in the room? All right, please, all those in favor?
All in favor, please say yes.
Aye.
Yes.
Thank you.
Yes.
Item 6 is a request for approval of a new grant agreement with Glide Foundation.
Hi there. Good afternoon, Commissioners. My name is Kianya Vinson. I'm the Equity Contracts Manager with the Office of Overdose Prevention. And I also have with me on the line Mike, where'd you go? Mike DeCebola from Glide Foundation. I'm here to request approval of a new grant agreement with Glide Foundation to develop and operate a peer-based contingency management program. The grant amount is for 4 years and is $2,640,560, which includes a 12% contingency. The grant is 100% opioid settlement funds funded, and Glide responded to a request for proposals that was awarded. The contract will provide 4 8 to 12-week cycles per year of contingency management to roughly 12 to 25 participants per cycle. And Glide has over 6 decades of experience providing wraparound support to individuals and families experiencing poverty, homelessness, and systemic injustices, offering services primarily from its flagship location in the Tenderloin. I do have some information about contingency management if you need that. I think you might already have that, but if you'd like me to talk about that, I can, and I can also give it over to Mike. Is he still here?
No,
A little?
Mike's on there.
Thank you. Commissioners, questions?
So has Glide provided contingency management services previously, or is this the first?
This is our first contract with them, but I do believe they've done contingency management before. Mike, do you have?
Can you hear me?
Yes, but please introduce yourself and your title.
You bet. Thank you. Thank you, Commissioners. My name is Michael DeCebola, Senior Director of Health Access Services at Glide Foundation. To answer the direct question, Glide has not offered contingency management in the past, but Glide does have a history of offering behavioral health outpatient substance use services in the past.
So
Proceed.
as I understand it, it's, this is a financially rewarding system for people to get off of drugs and whose behavior would improve.
Yes, and I apologize, I'm not the program manager for this contract. I'm filling in for him while he is happily in Italy. But this is the contingency management is the most effective form of treatment for stimulant use disorder. However, it's also been shown to be effective for encouraging adherence to medications for opioid use disorder, as well as other wellness activities. This program in particular will offer up to $599 in incentives per year for attending sessions, for providing substance-free urine samples, and also engaging in wellness activities.
Has this been tried other places?
Oh, yes, I'm sorry, I had that here. I believe San Francisco, yeah, the city currently funds 11 contingency management programs, 3 of which are funded through the State Recovery Incentives Pilot Program. Something specific to this program is that not only is it peer-based, but also there is a component for culturally congruent services. So they will be working to provide services that speak directly to some of the communities that are experiencing disparities, racial disparities in particular.
And commissioners, if I may, under former Director Colfax, this program was piloted and moved forward into the world, in the public health world. And my understanding is that there's not medical treatment for folks who use amphetamines or stimulants, that there's not a medicine that they can give someone to, to taper off as they can for opiates. And this is something that they found to be very helpful in the world that we're in today.
Yes.
May I add one other point? As I said, my prior job was Director of Behavioral and Substance Use Health at the San Francisco AIDS Foundation. And for over close to 20 years, I ran the only contingency management program in the city and county of San Francisco, directly funded through the Department of Public Health. And that program was a model program and actually led to a statewide bill where contingency management was expanded across the state of California. So I have considerable experience with this intervention. So I feel really confident we could do a great job creating a new program at GLAAD.
I also wanted to add that this program is part of a 3-tier proposal where there was a mentor organization and 2 mentees, and GLIDE won an award for a mentee organization. So the purpose is that they would be mentored by an organization with considerable experience doing contingency management, as well as another organization. So it's okay that they're new.
Surely. So clearly, I think in response to the question, it sounds like staff at GLIDE are the responsible parties for creating this program in the past. So that must be why the RFP came out as it did. Is there a motion to recommend this to the commission for approval?
I'll move recommended approval to the full commission.
I'll second it.
Is there any public comment on the item in the room? None.
All in favor, please say aye.
Aye.
Thank you so much.
Thank you.
Thank you.
Item 6 is emerging issues. Commissioners, hearing none. Anything in the room? No public comment. And then general public comment on this from this meeting? I see none. So commissioners, please consider a motion to adjourn.
Motion to adjourn is in order.
I move.
I second.
Thank you, everyone.
All in favor, say aye.
Aye.
Aye. Interesting.